I'm Dr. John Bennett. I'm a pediatrician at Canyon View Pediatrics. I went to Brigham University for my undergraduate education and then went to Milwaukee for medical school. I then came back to Salt Lake City and did a pediatric residency at Primary Children's, which I completed in 1994. My goal is to help parents enjoy raising thriving children. Development progresses through a predictable course over time, both with physical maturation, social and emotional development, thinking, language, and learning development. At routine visits, I help parents understand development and help them understand their influence that they can have on their children. Many things can thwart the thriving progress of a youth or adolescent. As a pediatrician, I correlate and integrate all the different things that might get a youth off course. Most problems are straightforward, but some have superficial or seemingly insignificant problems that actually cause major dysfunction. For example, I've seen youth who were having depression or social emotional problems because they stopped their sport. And they stopped their sport because they were having knee pain. The issue here was not treating depression, it was actually helping them fix or resolve their knee pain. I've had other children who were not thriving because they were sleep deprived. That was driven by eczema, which was caused by allergies. The situation here was helping the child with the allergy problems. Other teens, especially, I've seen who have had depression have had problems with intestinal blood loss. The problem was not so much treating depression, but figuring out why the child was having blood loss and treating the anemia. As a pediatrician, I have to evaluate and correlate all the different things that might affect the functioning of a youth. And I've worked very hard to be able to manage the majority of problems that can affect children's lives. It's very rewarding when I hear report back that patients are feeling good and thriving because of some intervention that I recommended. Pediatric influence is magnified over years of time because of growth and development. I get to be part of people's lives and part of their families. I've had people return to me after sometimes a decade of time and thank me for some small recommendation that I made that have a big impact on their lives. That's very rewarding. Canyon View Pediatrics is a pediatrician's paradise. Not only do I have the most wonderful patients in the world, but I also have the greatest pediatric partners. As a multi-specialty group, we can correlate and integrate the care of the entire family. At Canyon View, I also have all the diagnostic tools that I need at my disposal to take care of patients with high-quality medicine. We have lab, x-ray, and ultrasound available. I feel a great weight of responsibility towards patients and parents as a pediatrician. I try to keep things fun for the kids with fun talk, or the toys, or the looks. Sometimes things get challenging. Our success depends upon education and influencing behavior. I desperately depend upon parents to follow up if things are not going according to plan. I have no psychic or omniscient ability to tell if things are not going well at home. So I need parents and patients to follow up if things are not going as expected.